We have seen a shift in tone over the last little while when we start talking about the gravity of this outbreak. Dr. Bogosh, how has your own level of concern changed over the last couple of days or even weeks?
Yeah, certainly over the last 4 or 5 days, we really saw a pivot in this epidemic, and we saw a shift towards most of the burden of disease in East Asia and Southeast Asia. And now, of course, we have cases in Iran, and looks like there's more and more exported cases from Iran and more cases in Europe. So we're really starting to see the more global spread of this infection. And now we're really shifting gears and looking more into preparedness and mitigation strategies, and we're well beyond, containment strategies.
Right, and there is the sense of inevitability. I mean, you use the word epidemic. Of course, the word pandemic is being floated around, and the question being, at what point does this constitute a pandemic? So this kind of uncontained global spread. Let's listen to a clip. So this is a doctor from the U.S. Centers for Disease Control talking about this very thing.
Now, it's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will become infected and how many of those will develop severe or more complicated disease.
So, Dr. McGeer, that's the point that we're at now. It's not a question of whether this gets bad, it's how bad?
That's entirely the point. I mean, I think what we've been watching this gradual progression over the last 3 weeks of containment strategies failing. We've been learning more about the characteristics of the virus that tell us why these strategies are going to fail. And I think you're still watching people using delaying tactics. And one of the really difficult things for governments in the next few weeks is going to be how much is that delay worth, right? You can shut down Milan, and if that buys the world a week, is that worth having or not having? And those decisions about balancing spread of this virus against economic and health consequences associated with restrictions are going to be very difficult. But as you just heard Dr. Whitley say, it's not a question of if now, it's a question of when and how bad it's going to be.
So then, Dr. Hoda, I mean, how prepared is Canada on the domestic front? If we set containment aside, it's going to come here in larger numbers. And then by extension, how concerned should Canadians be?
I think we've had this lead time to actually work on preparedness. So that's the advantage we've had. There have been few cases here, and we've been focusing on this and trying to anticipate that the next stage would be we have to be prepared potentially for a pandemic.
And what does domestic preparation look like?
So within hospitals, we have some things that we focus on, making sure that we can detect cases really well, that we have access to testing, and that's something that we need to be thinking more about is how do we actually revise the way that we do things so that we have that access to testing and we can detect things well.
To be able to test people on a large scale?
Exactly, expand on that. And the other things is, can we isolate people well, and do we have the protocols in place for clinically managing people who are requiring hospital care with this infection, as well as others? So do we have the capacity to actually deal with this? And the supplies, the people required to care for those who are sick, as well as, the physical space.
Dr. Bogosh, on the question of whether a person can be sick without knowing it. So, according to Chinese researchers, there's a case of a woman from Wuhan who managed to infect 5 of her family members. She never showed symptoms of being sick. What do you read into that?
Well, we've heard a few cases now of people who may have either had no symptoms whatsoever or perhaps very, very mild symptoms who have transmitted this infection to others. And I think an important way to frame this is there might be many people who are infected with this virus who are either not sick or mildly ill, but really not sick enough to seek health care, not sick enough to see a physician, not sick enough to get a diagnostic test so that they know they have this infection. And if there's a large burden of these individuals, if there's a large number of people who are, infected, but again, not sick enough to seek health care, they're never really detected and they won't isolate themselves, and they can really contribute to the transmission of this infection in a community.
So isn't that quite alarming though then? Because when you look at the number of confirmed cases in any given country, that maybe that is just a sliver of the true number.
I mean, certainly the number of detected cases is probably the tip of the iceberg, and there probably are a lot of other global cases around that just either haven't been diagnosed for several different reasons. And this is what makes this infection challenging. I should point out that there's a lot of other respiratory viruses and other infections where people can shed the infection and only have very mild symptoms and sometimes no symptoms whatsoever. So that's not uncommon for many infections, but certainly in this situation, that's a challenge because it's hard to identify people, and this is why we're seeing this large global spread of the infection now.
What do we know, Dr. McGeer, about how sick most people who do get infected with COVID-19 end up getting?
Well, so the first thing we know is that most people don't get that sick. So based on current estimates, it's only about 1 in 5 people who get this infection who get seriously ill with it, and then a smaller fraction of that who don't recover from it. But as Dr. Bogosh has just pointed out, there's probably a lot more people who have even milder infections.
Right.
So
who haven't reported because they feel mostly healthy.
Well, either because they don't feel ill or because in the setting of, we're only 6 weeks into this. As Dr. Hoda pointed out, there's not enough lab tests. You can't test everybody. So you're going to preferentially test the people who are sicker and need to be in the hospital. So there's almost certainly this large group of people who are less ill. And that is actually a critical difference, because if there's a large enough number of those people, then what we're facing is not so bad. Might just be, the equivalent of an influenza season. Okay?
You would go that far, that to say, hey, at the end of the day, this could be on par with flu?
It could be. I think I'm waffling between, the hope that this is not going to be worse than flu, and the concern that this might be worse than a bad flu season, because so far the case fatality rate is looking higher than flu. But one of the problems is we still don't know that. So we still really don't know how bad this is going to be.
Dr. Hoda, what is it that you're going to be watching for over the next little while?
Well, I think I'm going to be personally watching for how this progresses. Is there going to be a lot of importation of cases to other areas where we haven't seen it before? We've seen some evidence of that already. How's it going to take off in different areas, different countries? And what information do we get about the clinical characteristics, to Dr. McGeer's point, when it's actually happening in places outside of mainland China, where there is a large burden of illness already, and that's impacting on the healthcare system and potentially on delivery of care. So outcomes might actually be influenced by that. So how does it look elsewhere?
Right. We wanted to talk about travel. So let's say I've got a trip planned to Italy, let's say, where there are hundreds of confirmed cases. What is the advice you would give to someone about whether they should go?
Well, I think part of it has to do with what's happening now, what's happening potentially in the future. It depends on when you're traveling, and really understanding what's happening locally in the area that you're going to. So, there are different pockets that are kind of hot spots in different parts of the country that you should be aware of. But ultimately, we don't really know how things are going to evolve in the next couple of weeks, let alone tomorrow, in some areas. So it's about your individual risk threshold to make that decision.
But would you, Dr. McGeer, would you be concerned about a trip all the way in the summer or all the way in the fall? Can you even forecast that far ahead?
I think it's too early to forecast that far ahead. I do think that people need to hold on to that, even if this is a more severe infection, there's still risks. There's risks to living, there's risks to traveling, and you need to take those into account when you're thinking about it. I think the additional risks that you need to worry about at the moment is perhaps less getting infected with the virus than getting stuck in some kind of travel restriction or quarantine, because people are still working on measures to mitigate. By the summer, that's probably going to be over. So it's really about, the question of what kind of risks are you going to take. If you go rock climbing for holidays, you're pretty safe going anywhere, okay?
Right. Maybe that's the bigger threat.
Because that's a bigger threat. So, so I think people need to be, I think there's this tremendous tendency to think, I just need to stay home. Because something awful might be out there. But this is going to be everywhere. Right. And people, you need to work a little bit, I think, at getting past the initial fear and concern about things being worse in foreign places, and think more about how you're feeling about the risk and what the real risk is relative to other things in your life.
So China seems to be an exception to that, where you have this advice from the federal government that folks should avoid non-essential travel to a place like that, and that is the epicenter, of course, of the outbreak. If you're considering a country, say something like I don't know, Singapore, Thailand, Australia, around the UK, where you have only a small handful of confirmed cases, do you think differently about that sort of a place?
Yeah, absolutely. And I think one of the key things is also just to stay up to date. I mean, there's Health Canada has wonderful resources on their webpage, and there's travel advisories posted on the webpage. So I think, as this epidemic or pandemic or whatever we're going to call it starts to play out and affect different places, there may be some shifts or changes in policy, both in Canada and in other countries as well, that may impact people's travel. So I think it's important for people to stay up to date and be aware of what these are.
If you do go, is there a precaution that you can take? I mean, there's no vaccine, there's no shot, but is there something you can do?
I mean, essentially, people should be very vigilant about hand hygiene. I mean, we know that despite this being a different infection than the flu, the recommendations are still the same. Wash your hands, stay home if you're sick. If you're coughing and sneezing, cough and sneeze into your arm, not into your hands. So, I mean, the general recommendations are still the same.
All right. To the three of you, always good to get your insights. Thank you very much.
Thanks for having us.